such a warm welcome. Thank you, Warden Jones. We're just going to take a few seconds for everyone to hop on, and then we'll get started. Okay, so it's 12 o'clock. Welcome everyone to our Thursday media briefing, and thank you all so much for joining us. So my name is Sarah Gill, and I'm taking over hosting for Brittany this week, but she will be back next week for you all. And we'll just get started with our land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Kerr Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they will continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So we're going to start with some opening remarks from our board chair, Mayor Andy Mitchell. Take it away, Andy.
Thank you, Sarah. 2021 has been a difficult year for many folks. Unfortunately, it is ending much as it began, in another wave of COVID-19. Despite this, I am confident that the people of the Peterborough region are not afraid. They are determined. Our community is not panicked, but is being prudent. Our residents have not been coward. They have been brave. Every day, community members have answered the call. Look around and you see them. The staff here at Public Health, volunteers at our vaccination centers, caregivers at long-term care, first responders, hospital staff, paramedics, essential workers, and the list goes on and on. You are all heroes. Think of this. In Peterborough region, 88% of adults have stepped up and begun a vaccine regime. 81% of those 12 to 17 have done the same. And every day, children between 5 and 11 are getting vaccinated. They are doing it not out of fear, but because they want to give themselves the best tool to protect themselves, their families, and their community. They are heroes too. As challenging as the situation is today, and how we may be inclined to imagine ourselves right back where we started in 2020, it is important to recognize that progress has been made. Vaccines are now available for everyone 5 and over. Vaccinated people who contract COVID generally have much better outcomes than those not vaccinated. New treatments have been and continue to be developed. Targeted measures to reduce contacts have been successful in blunting COVID waves. People want to celebrate this holiday season. It is a time for family, for loving, and being loved. It is because we care that our celebrations need to be cautious and designed to reduce the risk of making the special people in our lives ill. If you are ill or a close contact of someone identified as having COVID, stay home. If you assemble, do it in small groups, 10 or less, and reduce the number of gatherings you attend. If you do get together, consider reducing risk by assembling outdoors if possible, by being vaccinated and assembling with others who are also vaccinated, by wearing tightly fitting masks, by maintaining physical distance, and by ensuring your home is well ventilated. In closing, I want to wish everyone a happy holiday, and if you celebrate, a Merry Christmas. May the new year see a return to more normal times. Stay safe, be well, and in all things, be kind. Thank you.
Thank you, Andy. So we're going to move over to Dr. Piggott's situational update and move into his remarks.
Thank you, Sarah, and thank you, Mayor Mitchell, very much for those comments. This is the tracker showing our current number of cases. We're at 208 cases, 208 active cases as of the update yesterday. But I will break with tradition around the numbers and updates to share a very alarming figure, a very concerning figure, which is that since updated yesterday, already through last night and today, we have a total of 91 new cases of COVID-19 that we're reporting. And that is obviously far beyond anything we've experienced to date yet in this pandemic in the Peterborough region. As you can see, we are experiencing a significant rise in cases linked to the Omicron variant. And I do just want to know that as a result, we have removed the high-risk contact numbers from our tracker because we are now focusing our efforts around higher risk settings. And I'll mention a little bit more later in my remarks about our work with the provincial workforce. There is not clear data on the number of high-risk contacts. So we've removed that because it is no longer an accurate number. I can tell you that the number is substantial and ever increasing. We also want to let the community know that we will not formally update the tracker over the holidays. However, it'll be updated at noon on the 24th and again on the 29th. And we will communicate out to the public if there are substantial changes or developments that require communication. On to our next slide. I just want to note that showing and looking at our daily bar graph here, you can see that these significant cases are happening even in the last few days, and these are case counts by day. We have seen a significant increase in the last 5 days from on Saturday when we set a new record, unfortunately, in the pandemic with the number of cases, and many days since then having surpassed that. If we look on the next slide at cases by age group, this is extracted on the 22nd of December, showing for 1 week, and you can see still a significant number of cases in the younger population. On to our next slide, we have 2 active outbreaks that we're reporting on. One is in a school setting and one is in a long-term care setting. We have completed booster doses in all residents and most of the staff of our long-term care homes and retirement homes to protect this vulnerable population. And these congregate living settings remain a key focus as Omicron is circulating and we seek to protect people who are more vulnerable to severe COVID. On the next slide, you can see a map showing active cases over the last 14 days. And of particular note, you can see the transition of many jurisdictions, including Peterborough Public Health, into a purple color, reporting a significant increase in the number of cases. Over the last week, our average case count per 100,000 resident was 62.8, and that is climbing as case counts continue to climb. And on the next slide, you can see the dramatic differences in just the past 2 weeks, and you can see how quickly cases are climbing due to Omicron in Ontario. On a positive note, on our next slide here, we can see the work that we are doing and the success that is showing around our vaccination efforts. And it's really quite encouraging to see, and I'm so grateful for this tremendous accomplishment and all the continued work of the community coming forward and our team and our incredible partners that are working hard to get boosters in arms. This is not just Peterborough Public Health staff, but many more people, including primary health care, people from the hospital, our pharmacy colleagues, staff in other settings of healthcare. Many people are coming together and have rallied to the call to arms around vaccination efforts. And we're deeply grateful because this is obviously our most important protection in the context of Omicron. On the next slide, you can see what I want to share as a potentially encouraging and reassuring signal, which is looking at data, provincial data from the Ontario Science Table on protection of the vaccine. And you can see the percentage protection from the three variables we often talk about: cases or infections, hospitalization, and ICU admission. And while we have seen a dramatic dip off, and the expectation is with only 2 doses of the vaccine, protection against infection drops well below 50%, perhaps as low as 20 to 30%, with the outcomes of hospitalization and ICU admission. At this point, 2 doses is still really well protecting us, which is encouraging. But we do know that that booster, the third dose in this series, is really needed in order to protect against infection. And on the next slide, I just want to highlight here the rapid antigen testing that reporting that we have developed. We've developed a survey and QR code here where residents can report their rapid antigen test if they use one, and whether it's negative or positive, we are asking that people consider reporting it. It's helpful for us to track surveillance data. I will come back to rapid antigen testing in a moment. So I want to begin my remarks now by saying that there remains significant uncertainty in the context of this Omicron-driven wave of COVID-19. I want to talk a little bit about our vaccination ramp-up efforts. I want to talk about access to testing and the use of rapid antigen testing, and then I'll finish with a reminder of some of the tips to stay safer as we're heading into the holiday period. But before I do, I want to take a moment to remind you of some of the service disruptions that we've had as we've deployed staff to aid in this all hands on deck approach to vaccinating. So a reminder that many of our community services are being suspended at this time. Yes, we have been receiving a lot of public inquiries. We would remind residents to please seek out information as much as possible from our Peterborough Public Health webpage, peterboroughpublichealth.ca, as their first source of information before reaching out directly to us. Any other inquiries not addressed there can be addressed to our phone number 705-743-1000, and we have put a bunch of automated messages in to complement and provide resources for those who can't access online. Or if you have questions about COVID-19, you can direct them to covid19@peterborough.publichealth.ca for a list of resources to assist with your inquiries. From a vaccination standpoint, I'm really happy to see that we have now expanded the criteria, and we are getting many people coming forward with an interest in getting a third dose of the vaccine. The goal that I had set our team has been accomplished and surpassed. In the past week, we've seen a nearly 6-fold increase in the number of vaccine appointments that we are offering to residents in our efforts to accelerate rollout of the booster. The other thing that I want to mention is we still have many appointments left, and up until the middle of January, we have now 6,300 appointments a few minutes ago on last check that are still available for residents to book in to get their third dose of the vaccine. I want to talk briefly about the choice of the vaccine and supply issues. Residents may have seen that there are significant supply issues of the Pfizer vaccine across the province. And so we are not unique in this position. This is consistent with other health units across the province. We do not yet know when the supply of Pfizer vaccine will begin to improve. So at this point, we are asking all residents over the age of 30 that come forward for a vaccine that they receive the Moderna vaccine for their third dose. And this again may change with availability into the future. But as of now, we will have to save supply of Pfizer vaccine for people who are under the age of 30, because there is a NACI recommendation preferentially using a Pfizer vaccine for that population due to a lower risk of myocarditis and pericarditis. So the vaccine that you will be offered if you are 30 years and older is the Moderna vaccine in our vaccine clinics, and we hope to see an improvement in the supply chain provincially and nationally as soon as possible so that we can get back to offering both vaccines. But I do just want to say that there is also emerging evidence that the Moderna booster is possibly slightly more effective and protective against the Omicron variant. So it's a great vaccine. It's a vaccine that I've received for my doses of COVID-19, the Moderna vaccine, and I hope that residents do not concern themselves too much and cause too much consternation for our staff as they seek out their vaccine appointment, but recognize this is a provincial and national supply issue, and that we do need to conserve the Pfizer vaccine for those who do need that. The next piece that I want to mention is that as our case counts are dramatically increasing, the demand and work on our case and contact management teams is the highest that it has ever been as well. This means that we may not be able to reach cases and high-risk contacts within a 24-hour period, and that there is a delay in getting information out. Like other health units all across Ontario, we are working with what is called the Provincial Workforce Team uh, in order to get support centrally for contact tracing. This means most of our cases are going to the provincial team, and we are focusing our efforts locally on higher risk settings. Those settings include healthcare settings, long-term care, personal care home, congregate living settings. They include First Nation communities within our jurisdiction. And we will be emphasizing our efforts around contact tracing as quickly as possible in these higher risk settings and populations. So, as has been messaged across the province, we are now seeking resident support and awareness in the contact tracing work, because as much as there will be delays to getting to you, COVID does not wait for delays, and you can be at risk of spreading the infection to other people. So I have shared here on our screen the messaging we will be going out with. This will be consistent across our website, social media, and we will be working to actively push this messaging to anyone who does test positive for COVID-19. That messaging is clear. If you have any symptoms at all, including just a runny nose, we need you to isolate immediately and to expect that you will need to isolate for a period of 10 days. We need you to alert everyone that you've come in contact with in the past 2 to 3 days and ask them to begin isolating as well. We need you to seek out PCR testing, but recognize in our region right now, there is significant delays in getting an appointment. And in that time, we ask you not to worry, but to continue to follow guidance. If you do have rapid antigen testing available, consider using it. It is not typically used in these scenarios, but it can be helpful information. And if you test positive on the rapid antigen test, assume that you have COVID. However, because of risk of false negatives, we encourage and urge people that test negative to still assume that they have COVID. There is so much transmission happening at this time. I cannot stress or underscore the importance enough of complying with isolation in these settings. This is going to be really important to stop the spread of COVID-19 in our community. If you have a rapid antigen test and you test positive, you should also begin to isolate immediately and expect to continue isolating for at least 10 days. We ask you to alert anyone that you have come in contact with in the past 2 to 3 days to isolate as well. We ask you to seek out PCR testing, but again, recognizing there may be delays, I want to emphasize that delays in getting a PCR test will not impact your duration of isolation. So what you need to keep doing is to follow the guidance while you're awaiting that. If you test positive with a PCR test, obviously, please isolate immediately. The team, either here locally or provincially, will reach out as soon as they can. But we're in a position right now with this many cases of significant challenge in getting to people who test positive. We are creating a new webpage to help people really clearly understand the isolation requirements. So please stay tuned and we will share that. But we are really asking for the collaboration of residents of the region to help use their best judgment in all of this and to help mitigate the spread of COVID-19. I'm now going to speak a bit about rapid antigen testing because I know we've received a lot of questions about this. So firstly, a reminder that the kits for rapid antigen testing that have been distributed are distributed by the provincial government, and that has been through schools as well as their holiday pop-up testing blitz. If you have questions about this or availability, please do not direct those questions at us. Please go online to ontario.ca to seek more information. Rapid antigen tests are an important tool. We've actually had that technology available for well over a year in COVID-19, but there's been a lot of attention, obviously, lately. That attention lately has come from the fact that we're seeing more people who are vaccinated infected with COVID-19, and we are seeing such a significant spread. So the use of rapid antigen testing is a helpful tool. And I'm going to talk a bit about why we shouldn't be thinking about it as the only helpful tool, and we should not be stressing if we don't have access. But if you do have the rapid antigen tests and you do use them, please consider reporting your results to us, whether they're positive or negative. It's helpful for us as we try to keep an eye on what is happening with transmission of COVID-19 in the community. On our website, you can find an information page on rapid antigen testing, including direction on where to find them and a fact sheet on how to use them. If you're looking to use them to help make a holiday gathering that already fits within public health guidance safer, please be sure to use the rapid antigen test as soon immediately as possible before the gathering, because your test results can change quickly, and you shouldn't think of them as valid for any longer than the day, but the sooner before any kind of gathering, the better. And lastly, on rapid antigen testing, it is only one layer of protection. Just like we have to layer up when we go outside in the cold winter, we need to layer up in our response to COVID. If you do not have access to rapid antigen testing, that is only one layer of protection, and the other layers are just as or more important. I do hope that supplies of rapid antigen testing begin to improve, but in the interim, the other measures are what are going to be very important to keep you safe. You know, this new chapter in the pandemic and pandemic response has been significantly concerning as COVID is spreading more than it has ever before in our region. But I do want to provide a note of reassurance. We have been through this before, and we have the tools to keep ourselves and our community safe. And so I'll finish with a reminder of 5 tips to stay safer this holiday season. The first tip is to make sure that prior to any kind of gathering, you check local and provincial guidance and make sure that your activity complies with gathering limits, including the number of individuals participating. At the present, today on December 23rd, those guidance are for private settings that no more than 10 people can gather indoors or 25 outside. The second is obviously to get vaccinated. If you have not been vaccinated yet, please seek out vaccination. And if you have not had your 3rd dose yet, please seek that out as soon as you're able to get that scheduled. But also ask and look at any kind of gathering to ensure that other people you will be seeing are vaccinated as well. It is not a 100% defense against transmission of COVID, and people who are vaccinated can transmit, but it is the best tool that we have for prevention. Number 3, screen for symptoms. Get tested if you have any symptoms and stay home and isolate. If you do have access to rapid antigen tests, this testing can also work. Even if you do not have symptoms, you could still be infected and infectious to others. So rapid antigen testing, if you have access again, is a helpful tool. Finally, for number 4, spending time outdoors, very important. If you can, avoid indoor gatherings and prefer to go for a walk, have hot chocolate, or make a snowman outside. I hope we continue to have the white snow coming into the next few days. But you know, outdoor time is always safer than indoor time. And lastly, if you do decide to have an indoor activity or gathering, please make sure that you keep yourself as safe as possible by ensuring the space is well ventilated and that you are wearing a tightly fitted mask. So that with that, I just want to finish by saying thank you to all of our staff and all of our healthcare workers more broadly as we go into this holiday period. They are making sacrifices to help keep you safe. Please thank them for that if you have not had the chance to yet. If you see them, please be kind, please be patient. And certainly for our own staff, there has been no shortage of negative feedback that we have received as people are, understandably angry with various parts of the pandemic and pandemic response. But if you are willing, please send us a note. Please send us a holiday card, any kind of greeting, and I will make sure our staff see that and that they are motivated by that because, I want them to know how much you care about what they are doing and the sacrifice they're making. So with that, I'll turn it back to you, Sarah, and I'm happy to answer any questions. Thank you.
Thank you so much, Dr. Piggott. So I do see that we have a few elected officials on the line. And I believe Chief Carr, do you have any comments or remarks you'd like to make?
Hi, good afternoon, everyone. First, thank you for the opening this morning, and Chairperson Mayor Mitchell for those kind words that you had, and to Dr. Piggott for the update. And I too want to say thank you first. I was always taught by my elders to give thanks first, and want to say thank you to Peterborough Public Health and all the volunteers and everyone that is pulling together to make this work and keep our community safe. And as we do our part here in our First Nations and outside of our First Nations, and coming together as a greater community has been so wonderful to watch and see to keep us all safe. So I really do need to thank everyone, and I don't want to miss anyone. So I'll just put that out as a thank you to everyone who's doing all this good, hard work to keep us safe, to keep us doing the best that we can, and to also, looking after those who, have those mental health and addictions and the challenges they go through also as we go through this pandemic. But again, thank you very much. We will certainly be doing our part here in Hiawatha, and I'll be working on an update right after this so I can get it out to our citizens to be a part of that greater community and keeping everyone together and doing our best. I would also like to just say Merry Christmas and Happy Holidays to everyone. Be safe. Enjoy those moments if you can, even if it's just a moment, to take the time for yourself. And, go, like as Dr. Piggott mentioned, go for a walk, or in my community, we use cedar. We use our traditional medicines, and we drink cedar tea, or we have a cedar bath. It brings out the toxins, but it also is a cleanser too, and helps you mentally, emotionally, spiritually, and physically. So, just remember to take that time for yourself, whether just 5 minutes of mindfulness, meditation, whatever that piece may be for you, prayer. Anyway, I will stop there, but Merry Christmas. Please be safe, everyone. And I am honored to be part of this group and part of this area, and working together to keep us all safe. So miigwech. Thank you so much.
Thank you so much, Chief Carr. I know I heard Warden Jones on the line earlier. Warden Jones, do you have any remarks to add?
Well, thank you very much. I think you didn't hear me, actually. It was just a little indication that Santa indeed was on his way, so we'll keep track of that. No, I just want to echo Chief Carr's comments. Sometimes thanks is not enough, and there are so many people we do have to thank. The frontline workers, all the healthcare people, whether it's at the health unit or the hospital or in the doctor's office, whatever. These people have kept their head up, and they're just doing amazing things. And to all the negative people out there, and I know many of us have been confronted with that almost on an hourly basis. We got to get through this. We've got to see the light. We got to stay strong. We got to stay together, and we got to stay the course. So I just want to salute our county people as well. I consider them heroes. Our paramedics who are on the front lines every hour of every day, our public works crew who are out there doing their thing, they're all heroes as well. So I guess I just want to wish everyone all the best. Let's find time to smile. Let's find some time to be happy. Let's find some time to have a real Merry Christmas. We'll get over this. Let's have our chin up. So on behalf of Peterborough County Council and all the staff at the county, Merry Christmas, and I absolutely know that Santa will be coming to you. Thanks.
Thank you so much, Warden Jones. And I did see Mayor Tarion on the line as well today.
Hi, thank you. Always fun to follow Warden Jones. He always brings the festive spirit. It's great to be here calling in from Anishinaabe territory, Chimigwech to Chief Carr for that reminder about self-care, which is so important. And I'm happy to see that Brittany is off this week, hopefully getting some of that. And I hope that all of the staff at Public Health can get that hopefully over the next couple of days, because I did want to extend that thanks to Dr. Piggott, to Sarah, to everybody on the public health team that's been working so hard over the last couple years, preceding that, obviously, on all the other work that they do, but particularly around this pandemic, to the staff and volunteers across the sectors, at the vaccine clinics, at the rapid test distribution locations. I know Lansdowne Place was the hop-in spot this morning. I got my social fill there when everybody was rushing to try to get those rapid tests. It is really important to report your results, as Dr. Piggott said, for the tracking, but also so that that information is in your records. And also, the long-term impacts of this variant and of COVID in general are still not known. So, we hear a lot of talk about how it's, Omicron seems milder, but the concerning part is that we don't know that to be true, particularly in the long run, particularly the impacts on children. So I just wanted to kind of reiterate that, because I think it is really important. I know that we're all, fatigued and hearing the messages, but we do need to pay heed to that. And, to all the negative folks, I won't say what I really think, because sometimes that gets me into trouble. But I would say just put it away, save it. You're prolonging the suffering of everybody in this pandemic by acting that way. But thank you to the people that are being responsible, that are being community minded, that are taking care of not just themselves, but their loved ones and their community. There's a reason we live in a community with other people. And it's because we're, as the warden says, all in this together. So just wanted to, on behalf of the city, and again, thanks to all the city staff that have been working on this so hard, Brendan Wedley, who's on this call, for all his work, and his communications team, and to all the media folks on the line that have been covering this and helping to disseminate the information that's so important to get out to people. It's so greatly appreciated. Again, I know that we don't hear thanks often enough, certainly as politicians, but that's okay. But we put ourselves in that position. People in public health and people in the healthcare sector and that are volunteering did not put themselves in a public facing position to be abused. So save it, send it my way. That's fine. I can handle it. But anyways, to Dr. Piggott, to the whole team there, thank you so much. Miigwech, it's so greatly appreciated. Sending much love to everybody this Christmas season. Be safe, be smart, and be kind, as Chair Mitchell says. And thanks to Mayor Mitchell for all the work that he does as chair of this board and on all the other boards that he's on. I have the pleasure of working with him in several capacities, and he's a rock star. Back over to you. Thanks.
Thank you so much, Mayor Tarion. So we are going to move on to our media partners. And because I am very well versed with some of you, but not with all of you, it would be fantastic if you could put your hand up and I can go through the list there. Fantastic. Okay, so Paul, you are up first. Do you have any questions for anyone on the line?
I do. A couple questions for Dr. Piggott, please, and also some clarifications if I could. Do we know if this is the highest active case count that we've had at any given time during the pandemic? I'm assuming it is, but I'm trying to remember back, but it's been a couple of years, right? But it is the highest right now at any given time.
Correct, Paul.
Okay, thank you. Is it fair to assume, Dr. Piggott, because as you alluded to earlier, you guys are being run ragged and trying to catch up, and you only have so many staff. Is it fair to assume that the number of cases that we are seeing here, both active and new, are actually higher than what we're seeing?
Yeah, I would take that further to say what we're seeing is probably the tip of an iceberg because of delays and challenges accessing testing, and because of the fact that many people may be out there, may be asymptomatic, may not be thinking that they need testing because they've got just one or two symptoms and they think that they're protected by the vaccine. I suspect that the transmission is much more rampant than we're aware of.
Okay, thank you. And I want to go back to what you said earlier about the Pfizer vaccine versus Moderna. How new is that? I got boosted on Tuesday, and I was offered an option up at Thomas A. Stewart of having either one. So this is fairly new, correct?
It is being put into place as we speak. We wanted to communicate out to it for the public, but it is consistent with other jurisdictions as well in the context of this province-wide shortage.
Okay, thank you. And another thing, I'm hearing or read some stuff, and I'm sure you have, about South Africa and some reports that the situation there, the numbers are easing somewhat. Are you aware of reports coming out of South Africa where Omicron was first discovered? And does that encourage you in any way that we may see a similar shorter lifespan to this variant?
Yeah, I think it's encouraging. I think to use a forest fire analogy, when the fire burns fast, it may burn shorter, and that may be the case with Omicron. We are not on the top of the mountain yet. I don't think we're anywhere close to it. So we have many more cases to come through this. The modeling certainly suggested we're going to get far higher before we're at the peak here in Canada. The biggest challenge in interpreting some of the international data is that context is everything. And in South Africa, they have a far younger population. Their average age is in the 20s, as well as a population that's actually been infected, not vaccinated, but infected with COVID multiple periods. The majority of the population has been. And so whether that infection plus the vaccine rollout they've done provides more protection than our community has, I would be concerned about that. I think it's a high likelihood, but certainly my hope is that this does not last too long, and this will pass. But the measures that we have put in place, continued work around the booster, and everyone's support and collaboration in isolating and notifying their own contacts will help us to get through this quicker.
Thank you. Just a couple more things. Last week, you were quite alarmed, and rightly so, and concerned about pandemic fatigue. Based on what we've been seeing at the clinics, the booster third shot numbers are climbing. Are you heartened by that? That pandemic fatigue is still a thing, but are you feeling a little better about how we're responding now than you did a week ago?
Yeah, I think people are starting to realize that this is here. We have the highest case count, I think, in the history of the pandemic in Ontario today, and the public is, I think, more attuned to that. And I'm very heartened to see all of the individuals coming forward for the third dose of the vaccine. And to see the wonderful support and compliance that we're getting from the public, but also, all of our businesses, small businesses, all kinds of operators around the region who've been hit and impacted by the changes. Everyone is collaborating. Everyone wants to get through this, and I think that we will. I just think that we're not through the thick of it yet, and we have a lot of work to do to each and every one of us play a role in helping stop the spread.
Absolutely. And finally, and correct me again if I'm wrong, but I believe there's a new death reported since we met last Thursday. It's 28 now, and I think it was 27. Do you have any details at all on that most recent death?
Yes, I do. It was an individual who was, I believe, and Sarah, correct me if I'm wrong, because I know we responded to a media inquiry about this, but I believe it was an individual in their 40s who had other medical conditions and was not vaccinated. But we can confirm that in follow-up for you, Paul.
Thank you. I appreciate it.
Sorry. Fully vaccinated individual in their 40s. Two
They
doses.
were fully vaccinated, a 2-dose vaccinated. Thank you for clarifying.
But had an underlying condition, I think you said, or other medical condition.
Yeah,
yeah.
We'll get back to you, Paul, to confirm that, so you have the exact details, right? Yeah, I know we responded earlier, and I'm getting a message from one of my managers that that's correct. There was a complicating factor, but certainly still incredibly tragic.
Yes, I saw that message. Thank you. That's it for me, Dr. Piggott. I wish you and your family a great holiday season, everybody on the call, and let's stay safe. Thanks so much.
Thanks, Paul. Yeah, thank you for everything you do in your communication, and to the whole media team. You're great partners and support in this as well. Happy holidays.
I certainly second that. Thank you so much, Paul. So moving on to Bill Hodgins.
Hi, just a couple of questions for Dr. Piggott. The 91 new cases to date, that's pretty alarming. Do you know how much of that is attributed to people self-reporting?
That is for formal reporting, not including our self-report numbers.
Oh, okay. Thanks.
Yeah, so those are formal report cases from today. With self-report, we are getting a number of other cases coming in. There's been a total of, with the rapid antigen test, that is, there's been a total of 71 individuals report that they are positive, and we're still working through that information. And that is over nearly a 1-week period. So there are additional people who won't likely have had the opportunity to get their confirmatory PCR test, who we know are rapid antigen test. And again, as is our guidance in the slide that I showed and that we're sharing, individuals who a rapid antigen test positive should consider themselves to have COVID infection. The chances with this much COVID out there of it being a false positive are near none.
Okay, that's helpful. Thanks. The other question I had, the first time the vaccines were rolled out, they were staggered more frontline workers and then through different age groups. I've heard some people complain that it's more of a free-for-all this time. Do you think it should have been staggered?
I think in all public health programs, it's important to think about equity and fairness and use a lens that incorporates that. I know that that sometimes needs to be balanced with other logistical considerations. So I think this was a difficult decision, no doubt.
Great. That's good for my questions. Thank you.
Thank you so much, Bill. Moving on to Matt Latour.
Hi, my questions today are for Dr. Piggott. So I'll start with the 28th local death. And I assume you mentioned that, you don't have all the information. So if you have to get back to me on this, that's fine. Do you know if they had the Omicron variant or was it the Delta variant? Is that known at this time?
We don't have confirmation on all of our cases yet, but it would have been, it would not have been an Omicron variant based on dates. Yeah, it would have been likely Delta variant.
Okay. And so I know the rapid antigen tests, obviously, there's been a lot of talk about them the last few weeks. And I've heard a lot of people complaining that they can't get one because the lines are crazy at Lansdowne Place or at the farmer's market. Do you think that having them handed out at public areas like that was the way to go? Or do you think maybe they should have been mailed out? Or I guess just kind of your thoughts on the rollout of these rapid antigen tests?
I think there have been, a number of issues through the pandemic that have been challenging and difficult to predict. Like I mentioned, rapid antigen tests have been available for well over a year, but they haven't occupied the same kind of frenzied interest as they have in the last week. And I don't know that that was predictable. I think that there are stock limitations and challenges. I think that these are available for commercial purchase online. So I would hope that we could emphasize, at least on a go forward, trying to make them available for people who might not otherwise have the means to access them. I think that would be very important. But all of that considered, and given the supply challenges and logistics, I think that people are doing the best that they can to try to get out a tool, which again is useful, but not the only tool we have and not the only tool people should rely on.
And my final question had to do more so with testing and how that's going. I know it's a lot of people right now are looking for tests, and we're seeing more positive tests coming back. Do you think we'll see a return to the drive-through testing format like we saw earlier in the pandemic?
I would redirect that question to the hospital, who PRHC, who has responsibility for testing mandate. But yeah.
Perfect. Thank you.
Thank you so much, Matt. And I will follow up with you after about that question. So moving on to Reg Watson.
Just a quick question heading into the holidays here. What is your advice, Dr. Piggott, to people who may need to travel out of the region for the holidays, and also for people who are or already have jetted off to a southern destination for a vacation? It doesn't seem like, I believe the federal government has advised against unnecessary international travel, but what is the advice, or is the feeling that because the variant is already here, it doesn't matter about these trips? What are you advising people?
Well, I think I would advise that people obviously stick within formal public health guidance. Beyond that, which is something like the requirement to have a speed limit when you're driving, everyone has to make their own risk assessment and decision. Just because the speed limit's 100 kilometers an hour doesn't mean that if it's snowy and icy and the roads are dangerous, you should be driving that fast. And so everyone needs to make their own risk assessment decisions around their own context and situation. I personally have two daughters under 5 years old that neither of whom have had their chance to be vaccinated yet. People may have people like that in their lives, or other people who have medical risk factors, or who are elderly, who are at higher risk of severe outcomes with COVID-19. And I think that they should consider all of these things in the decisions that they make. The challenge with travel right now is that you do not necessarily know what the context you are going into is. With the burden on our testing system here locally, in other countries or in even other parts of the province, we may not know what the state of COVID is and what circulation is like. I would say if people are considering any kind of travel, to ensure that they have 3 doses of this vaccine, because that is the minimum required. That is what's required for protection at this point from infection. And beyond that, the safest option is always to stay home and to minimize contacts. But I think that people do need to make their own decisions around this beyond what the guidance tells us to do.
Okay, thank you very much.
Thank you so much. So I do see, Bill, you still have your hand up. Is that legacy hand? Okay, thank you. And moving on to Jessica Niznik.
Thank you, Sarah. Just first of all, I made a note in the chat there, if people could please mute themselves when they're not speaking, because I need the audio for television. Thank you. Hi, Dr. Piggott. Thanks for your update today. I do have a few questions. Because Pfizer is now being saved for people who are 30 and under, my parents are booked for Pfizer tonight. Should I be telling them not to get it? And first of all, I'll ask you that first. And also, pharmacies are still obviously giving Pfizer to whoever. My parents are 69. I'm guessing that's because the vaccine can't be moved once it's arrived somewhere. But maybe explain how that's happening, and should people over 30, I'm now concerned kind of for my parents.
So they are both good vaccines, and they are uh, fully protective. I want to underscore that. This is a supply chain issue that we hope is temporary in nature. If somebody has an appointment, regardless of where it is, please go ahead and get that vaccine, because the booster protection is really important for people right now, especially people who are older in age or at risk of severe COVID. That is separate from the fact that we are and this has been at different speeds depending on stock and availability in different health units across the province, moving towards this for our clinics and our sites. And I do know that there may be, similar shortages in pharmacies and some other health units in the coming days for sure. But thank you for the question, Jessica.
My pleasure. You mentioned that PRHC is, I believe you said, looks after testing, because I was thinking, why don't we add more testing? We used to have paramedics involved in testing, and if there's such a demand for testing, is there any more we can do to get more testing going here in Peterborough?
Yeah, thanks, Jessica. I know it's a challenge across the province right now because we have seen such an explosion in COVID-19 cases. But again, I would direct questions around testing capacity to PRHC, please.
Okay, no problem. Just wanted to make sure. Yesterday at HKPR, they're experiencing a lot of struggles. They said in the new year they may not even be able to contact COVID cases directly because that's how short-staffed they are. And they're speaking about hiring more staff. Is that something that PPH is considering to help deal with the demand?
Well, we have been, as I mentioned, working with this provincial workforce team, which is a large centrally coordinated surge support group for COVID-19 contact tracing work. And so we are getting significant support from that group, and we're looking to increase our capacity as needed as time goes. We are balancing that with getting the message out publicly to people, like I've been talking about, that even if you do test positive, this is the guidance and the message, what you need to do immediately if there are delays in us reaching you. And we're trying to ensure that those results and the initial guidance and instruction are automatically sent to people as quickly as we possibly can. And so we're working through those pieces. We're looking at capacity issues. But right now, our main focus in ramping up capacity and increasing staffing has been entirely around vaccine, because we know boosters in the arm now will really help to protect and save us as Omicron cases increase coming into the new year.
Thanks. And then just two more quick questions. Did you mention, and I'm sorry if I missed it, when the 28th death occurred?
It was in this past week.
Okay. And lastly, you mentioned that the rat tests, there were 71 that were self-reported, but you said they're not part of the 91 that we had overnight. So when would they be included in our tally?
So those numbers are unofficial, and that's something we've put in place locally to glean a picture of what's happening in the community. So it's an additional source of information. The official numbers come from our PCR test results. So that's what we have 91 of, and 71 was again self-reported by individuals in the community over the past week. Those haven't been verified. We are working on processes to push information out to individuals and make sure that our website is clear on what people need to do if they do have a rapid antigen test that is positive, or if they have symptoms and they're at home. And so we're working on all of those pieces and processes right now. But the reality is our cases have exploded this week, and 91 cases so far today. The final reported number will no doubt be higher, and that's on top of several records unfortunately set this week in terms of the number of cases.
Thank you, Dr. Piggott. That is it for me. And I just wanted to take the opportunity to wish you and your team a happy holidays, and all of my media friends on the line happy holidays. Have safe holidays. And lastly, on a lighter note, J. Murray Jones, if you're still on, that was a nice sound up you had earlier. I wondered when the health unit started doing sound ups, but it was you. Thanks.
I was
Thank
totally
you.
going to give compliments to Sarah for that, but yeah, no, thank you. Thanks,
Ooh.
Jessica. Thanks everyone for being here.